I think that nursing chose me rather than me choosing nursing, because I've always wanted to be a nurse ever since I was young. I remember helping my brothers when they were sick. I would always go get like a cold wash rag or something and put on their forehead. I would take their temperature, and that's something I really wanted to learn and continue. So that's kind of why I chose nursing as my major. I'm not really sure what kind of nurse I want to be yet, actually. Kind of hoping to get a better idea after our clinicals. We've already done community clinical rotations, but I really think that I would do well in like the surgical unit, so probably a scrub nurse or something like that.
That's a funny question. Still. So, I could probably tell you more about family life, because honestly, social life is kind of non-existent for me, at the moment at least. Freshman year, if I had picked a club that I really was passionate about and liked the people in it, and then set kind of a marathon pace to follow for that, I think that would have been better. And if I had just kept up like a small amount of involvement in one group with one group of friends, instead of diving into stuff freshman year and getting really involved and then having to completely pull out, probably would have been better. Would have maintained a lot of friendships. So just investing in the people in your group in nursing school is super important, because you're all you have. Sometimes it's hard, but when you've got people that you trust there and you're not competing with each other, it can be a beautiful thing to have them.
The biggest one for me by far is time management. That was something that kind of slapped me in the face come freshman year when I had a job and had to kind of work on everything at once and set time aside to study, set time aside for a social life. Think on a Friday night, am I going to go out with my friends or am I going to study for the exam on Monday? You have to think of your long-term goals and why you're here and why you want to do it, and that is the perseverance that keeps you going. Is you have to know why you are here. You have to know why you want to be a nurse. And if you know that, then you'll go far, as long as you figure that out for yourself and get that solidified within yourself.
To be honest, when I was in freshman year, I gained the freshman 20 or 25, as you can put it. But I started realizing that I really like to help promote health. You know, in nursing school, you don't really have time to work out, and you're getting food on the go, and it's really easy to get into the cycle. I started exercising and eating better, cutting out like going out with friends and getting fast food, because you know that's really easy to fall into. I started making healthier choices like salads, veggies, smoothies, and a lot of protein and chicken. Wake up early to go run, or even if it's just for 30 minutes or like a 15-minute ab workout or something like that. Like, you have to push yourself if you want to stay healthy, especially in nursing school.
The best way to stay concentrated is to hydrate yourself. That's a big one. Always have a water bottle next to you. I love to go do activities that like distract my mind for like 10 or 15 minutes. So I'll go and I'll like go for a run or go for a walk, or even go make myself coffee or tea. You have to always refocus yourself.
Well, I think that's a little different for everybody, I guess. You know, the exams are definitely tough, just in nursing school in general. Keeping up with your assignments, like having good, you know, time management. I have a planner. Every single day is planned out. Every hour of every day is planned out, what I'm doing, how I'm studying, taking breaks to go work out, to keep my sanity. You know, I think what's unique about nursing is it does take a lot of extra time, a lot more time than most other majors. And just not just studying for the test, but studying to know this stuff, because you're going to be in the hospital one day. And so you lose a lot of social time, you lose a lot of friend time.
You know, in high school, it's really different. You continuously have your mom and dad monitoring you and where you're going, who you're with, how late you're out. When you are in college, it's quite different. You don't have parental guidance. You don't have someone telling you, oh, maybe you should be wise and not go out to that party tonight, or you know, stay in and study. So you are kind of in control of those decisions and questioning, like, should I go or should I stay?
Okay, first, like food and coffee, for me at least. I usually, you know ahead of time when you have exams. So if I were to like plan a study night, I would grab like a box of Wheat Thins or whatever my snack is that night, and it's like, I feel like it's important for me to find the right people to study with. And so a lot of times, even though your friends or classmates are like fun to be with, they might not always study the same as you. And so that's really important to find people who study like you, so that you can, bounce off each other and kind of get that information in your brain right before the exam. For example, freshman year when I took anatomy, me and my roommate Monica would always be in our dorm room, and when learning like the bones and the muscles, we would draw them actually like on our body and write them so that we could see where they are and like how they moved, and it would get that kind of in our brain better than just reading off a PowerPoint or reading a book. So finding those little ways to kind of learn it differently really helped me with study nights.
Here at Lee, we do our admissions a lot differently than a lot of other programs. We do have it set up so that freshmen can come in and start our nursing program from day one. So that's a big difference from a lot of programs where you have to go and do your prereqs first and do all those kind of things. And there's a lot of pressure on all those classes. The nice thing about Lee, though, is that we do things differently, and even if you may not be as good at testing, or you may not have done well in your first year of high school, or something like that, you do get to start with us as a freshman, no matter what. You'll have nursing from day one. We give you that first year to show what you're capable of in those classes, and then after that first year, we look back and see how you've done. And so it's a really nice thing to be able to kind of prove what you're capable of in those classes. And what I usually recommend to students is to try to get A's and B's in those classes. That's really what our admissions committee looks for, is A's and B's, but most students are already shooting for that, so it's not too bad. There's two main clubs for our nursing program specifically that we have. The first is the Student Nurses Association, and that's a club that really is involved in a wide variety of nursing kinds of things, and that goes for certain things like working here on campus with doing our orientation cookout that we do, all the way to going to Nashville, and they actually met the governor this last year. And so there's a lot of things that they're involved in with nursing and getting students involved in different activities that are around our nursing building and campus itself. The other one that we have is the Nurses Christian Fellowship, and it's NCF, and they are focused more on the spiritual aspect of nursing and medical care. There's a lot of things that come into nursing. You deal with death and dying and depression and all those kinds of things in nursing that you'll see in your patients. And so that organization is more focused on that side of things, and how do you deal with that as a Christian, and what are the appropriate ways to respond, and how to pray with someone that's in those situations. And so that group does a lot of those aspects, but they also do a lot of different events around campus as well. Yeah, there's a lot of cost in nursing. That's definitely no secret, and that's the same anywhere you go, because there's just so much in nursing. You'll need that uniform, as you mentioned. You need a lot of equipment that you'll use throughout your labs, and even after you graduate, you'll take a lot of those things with you and be able to use them as you go. But as you come in, if a student comes in as a freshman, the good news is there's not very many costs right off the bat. You'll have your freshman year is pretty much the same as any other classes you'll be taking here at Lee. You'll have some books and those kind of things, but otherwise it's pretty cheap as far as those things go. The problem is that once you start your sophomore year is when it gets really expensive. It's probably the most expensive time of all your semesters for our students, and that's because there's a few different big purchases that you'll have at that time. The most expensive, as you mentioned, is our book bundle, and that's because we put most of our books in one bundle that you guys will need throughout your entire time in our program. And so that bundle, because there's so many books in it, and because it goes for pretty much the whole time you're here, is very expensive when you have the couple of payments that you do. So in between your freshman and sophomore year, that's when you'll make that first payment on the bundle, and it is around $600. So it's very expensive, but it does include about 8 books, and they'll be used throughout your time in the program. The other piece that you do have to pay during that time is the scrubs and the other uniform things that you'll have. The scrubs themselves are what we call our primary uniform, And then our secondary uniform, you'll have a polo that you'll buy, and it also has the School of Nursing on it. And then you actually also have a t-shirt, which is your casual uniform. And so between all those, it does add up pretty quickly, even if you only buy one set of scrubs. It'll probably be about $100 to $150 somewhere in there with all those different pieces. Then you also have to consider that we have specific shoes that we do require as well, whether it's for both of those uniforms, especially the primary uniform is very basic and plain, and most students don't have plain white shoes that have nothing else on them and also can't have any cloth or anything. So you might need to buy new shoes for those. And those could go as cheap as $20, but most students pay a little bit more so they can have ones that they really do like. At that time, you're also buying a stethoscope and a lab kit and other things like that. The exciting thing is that you'll be starting your labs and those kind of things, and so it is really neat to be able to get those tools and to be able to use them. But these are things that you'll need, and between those two things, it can also add up to $100 to $150. So it's pretty clear that even with that bundle, with the uniform, and with those couple of tools that you'll need, it's close to $1,000 just with those. And so it can be very expensive. And then you're still also in some of your other prerequisites and some other core classes. So you'll also have some other books on top of that for other things outside of nursing. So that's the most expensive time. So we really do try to get you guys prepared for that as early as we can. The next big cost is during your junior year, right before you start with us again in the summer. The good news is maybe you can get a summer job and work for some of those costs, but you'll have your second payment of that bundle. You only have 2 payments, so that's the good news. And it's actually less than the first payment, so it's around $400, but that's between your sophomore and your junior year that you'll have to pay for that. The other big expenses that come in right around that time frame are when you get ready for your clinicals, and you have a lot of different requirements during that time. You have to do a background check, you have to do a drug test, you have to do a TB test, which is a skin test that you have to get every year. You'll have to make sure that you have all your immunizations, so if you don't have any of those, you'll have to get those at that time. You do need a flu shot during that semester, so that's usually not too expensive, but it's another little cost that's in there. You do have to become CPR certified, and that can be around $50 by itself. And so when you add up all those different little pieces, it can turn out to be closer to $200 just with getting all those requirements taken care of. So between those two pieces, the second payment of the bundle and all the things that you need for your clinicals, you're going to be spending definitely over $500. And then you may also have lab kits that you might need each semester when you go into your new nursing labs. So those are the big expenses at that time, and you may also want some extra scrubs because you're going to be in clinicals multiple times a week, and you definitely aren't going to want to do laundry every single time you wear them. So it's a really good thing to have extra scrubs so you can use multiple different pairs throughout the time. So everything gets a lot less expensive from that point on. That's the good news, is that between your sophomore and junior year, that's a big cost, but then things get less expensive because you're done paying for the bundle. You'll have all those books, so you might have a few books here and there, but most of those are paid for throughout the whole rest of your time. But things get kind of expensive again when you get close to graduation, and that's when it really comes in very quickly. So when you get to the graduation, you have to apply for graduation here at Lee, and that's $100 by itself. Then you have to actually apply for the NCLEX to take the test itself to become licensed, and that's $200 to register for that test. Then you have to do another background check and get your fingerprints done with part of that, and that's about $50 that you have to do. You have to get your senior pictures because we want to make sure that we broadcast that you graduated, and that's an exciting thing for our students, but that can be a little expensive with about $50 just for that. And lastly, you actually do have to apply for your licensure, whatever state you're going to actually work. Most of our students, if they're from around here, apply here in Tennessee, and that's $100 to apply for licensure. So that can add up to about $500 just for your graduation materials. And that doesn't even include the nursing pin that a lot of our students want to buy. We have a pinning ceremony, which is a really special time for nurses to show that they've completed all the requirements. And that pin is probably going to be close to $100. And so if that's something that you want to buy, it's kind of like a graduation ring, and it can be a little expensive as well. There are a couple of things to keep in mind about all these costs, because I know that's a lot. And the first thing is that it is spread out. And so when I tell you all those things, I know it's a ton of money. It really adds up very quickly. The nice thing about it is that we do try to let you know as early as we can about those things. And as you go, we will spread it out over those times, even though there are a couple of very expensive semesters. The other thing that's really important to keep in mind, and probably more important to keep in mind, is that overall, those costs are at really exciting times in our program, when the first big cost in between your freshman and sophomore year is when you're going to be going into your labs for the first time. You get to try on those scrubs and wear them around and be proud of that you're a nursing student. In between your sophomore and junior year, you're going into clinicals, and you're actually going out into the real world and using your skills. And that's a really cool experience. And so some of these times when you have these costs, including graduation, when you're finishing up, are really good times when you can celebrate what you're doing. And even though the costs kind of are not easy to cover, it can be really exciting. And especially that last one, graduation, you know that you're about to finish, and hopefully you can go get a job and make back some of that money that you just spent throughout all of nursing school. So that can be a really good thing.
A college student can do a lot of things to prepare for grad school. First thing to do is figure out which grad school you want to go to, where it's at, how much it costs, and the requirements of that grad school. Each one is different. Not everybody's the same. That's what I'm learning. And one thing you can do now when you get into college is to make as high a grade as possible. You need a high GPA. You got to get a high GRE score or a GMAT wherever you're trying to go. It's all different, and you have to research very well where you're going, because of course the requirements are different, and so you have to kind of differ between which one suits you, your personality, and where you want to go and what you want to do.
Definitely. It is probably the hardest thing I've ever done, like I have to say. Growing up playing sports or just dealing with like life stuff in my family, it's definitely like very challenging just to get through it on like a day in and day out basis. But it's doable. I'm almost done. There are people who do it. So I guess my advice would just be don't give up and don't get discouraged, even though it's really easy to, and just take it one day at a time, one PowerPoint at a time, one exam at a time, and definitely like lean into your friends, make friends with your professors. It's really important.
The U.S. News World Report published the 2016-2017 Best Hospital Honor Roll in America. Each hospital is ranked on 16 different specialties. There are 4,667 hospitals that were analyzed in the rankings, and they are updated annually. The third highest ranking in the overall score of 371 goes to Massachusetts General Hospital in Boston. They ranked number 1 in the specialty of ear, nose, throat, and psychiatry. The second highest ranking with the overall score of 379 goes to Cleveland Clinic in Cleveland, Ohio. It is ranked number 1 in cardiology and heart surgery, as long as number 2 in GI surgery. The highest ranked hospital in America, which is no surprise, is the Mayo Clinic in Rochester, Minnesota. They ranked number 1 in 9 different categories. The highest level of nursing is your Doctor of Nursing Practice, DNP. This builds on from master's programs and enhances evidence-based practice. This degree is preferred when entering into the field of education. According to the American Medical Association, most resident doctors are paid within the range of $40,000 to $50,000 a year. Residency lasts anywhere from 3 to 7 years depending on the specialty of training. Based on the rankings, Vanderbilt School of Medicine in Nashville, Tennessee is the top school in Southeast Tennessee. It is small with a total of 407 students. The mean GPA is 3.88 and the mean MCAT score is 36 out of 45. On the other hand, tuition is quite expensive at $45,000. RegisteredNursing.org recently posted the top nursing programs in the state of Tennessee. Bethel University is ranked number 3, Tennessee Tech at number 2, and coming in at the number 1 spot is University of Tennessee at Chattanooga, UTC.